in law enforcement. What is the second one? Medical dash is the role of law in medicine. Jurisprudence. Medical jurisprudence is the role of law in medicine. How the law regulates our medical profession. So if you want to terminate pregnancy, it has to be as per the MTP Act. The law is regulating your medical profession. Third one, medical dash is a self-imposed code of conduct. What is the code of conduct? Medical ethics. Medical ethics is a self-imposed code of conduct. This code of conduct is given by the medical councils, the National Medical Commission as well as the State Medical Council. And what is the last one? Dash, conventional laws of courtesy. Medical etiquettes. Medical etiquettes are the conventional laws of courtesy. Courtesy means manners. Teacher enters the classroom, you stand up to wish your teacher, that is courtesy, that is manners, right? You follow courtesy, it's good. You do not follow courtesy, it's absolutely okay. No problem whatsoever. Next, medical ethics. It is the code of medical ethics which is given by the National Medical Commission. They issue certain warning notices. Warning notices, they tell a doctor what a doctor should do and what a doctor should not be doing. There are many things which are covered in the warning notices. These include adultery. Adultery means infidelity. Infidelity means cheating on your spouse. When you talk about adultery in medical practice, it means when a doctor performs sexual intercourse with a patient. If any doctor performs sexual intercourse with a patient, then that amounts to infidelity or adultery in medical ethics. So if your question says a doctor is practicing intercourse with a patient, what does it amount to? It amounts to adultery. Association is also known as covering. Association means associating yourself with an unqualified individual. In India, you have so many clinicians who have their own medical practice. In this medical practice, these clinicians, they appoint a helper, a compounder to help them out. Now, these compounders are 10th pass, 12th pass. They do not have any valid qualification. But along with the doctor, they dispense drugs, they distribute drugs. And many times, they also prescribe drugs. That is association. Next A is advertisement. A doctor is supposed to advertise in a dignified manner, which is dignified as per your profession. You cannot put a very big banner. On that very big banner, you cannot write number one doctor of India. You cannot write cheapest doctor of India, right? सबसे सस्ता सुंदर टिकाऊ डॉक्टर हो, you cannot advertise like that. You have to advertise in a dignified manner. Alcohol addiction, writing it over here, does it mean a doctor can never drink alcohol? Not like that. Whatever you want to drink, you can drink. The only thing is, you should not examine or treat a patient when under the influence of alcohol. Which abortion is unlawful abortion? Anything which is outside the MTP Act is an unlawful abortion. Any false certificate you issue, it is covered in warning notices. Next, dichotomy, which is also known as fee splitting. You take or you give commission, that is dichotomy. So you refer a patient to a particular lab, telling to the patient the results are very good, but actually not concerned about the result. You are concerned about the commission you will be getting for every test done in that lab. That is dichotomy or fee splitting. Lastly, a doctor should maintain professional secrecy. Whatever the patient tells, that should be kept as a secret. There are certain exceptions to this, which are referred to as privileged communications, where you can disclose the condition of patient to someone else. That is privileged communication. Can you give me an example? What communication can be a privileged communication? STD. Patient suffering from sexually transmissible disease or patient has committed a crime, then that may be covered under privileged communication, where the information can be divulged. You do not follow warning notices, you are guilty of this. A very important MCQ for your exams. Serious professional misconduct or infamous conduct or ethical negligence. A doctor violates anything which is given in warning notices, he is guilty of this, and then he is liable for punishment. Punishment can be warning, fine, or नाम हटा देते हैं. So what do you call that? Penal erasure. Erasure means removal, penal means penalty. In penal erasure, the name of a doctor is removed from the medical register maintained by the medical council. You all are trying to give the FMG exam. Your main purpose to give the exam is so that your name is entered in the register maintained by the medical council, so that you are allowed to practice your profession in India. If your name is not there, you cannot practice your profession. In penal erasure, the name of a doctor is removed as a punishment, right? That means you will not be able to practice your profession. That means it would amount to a death of your profession. You cannot practice your profession. And that is why penal erasure is also known as professional death sentence. That is the first part, medical ethics. Very important for your exams, mainly because you are appearing for the FMG exam. The medical council, they expect you to know certain basic things about what you should do while practicing your profession in India, right? So the first thing, medical ethics. Next, inquest. This is an inquiry in a cause of death. Inquiry in a cause of death is inquest. Person dies, whatever inquiry is being conducted, that inquiry is inquest. Mainly in India, you have two types of inquest. The first one is police, second is magistrate. Police conducts inquiry under which section of CRPC? 174 CRPC. Magistrate? 176 CRPC. There are very few sections which are actually very important for your FMG exam. So amongst them, these are the first two sections, police and magistrates inquest. Next. Generally, the inquest that is done in India is the police inquest. A magistrate inquest is done under certain specific conditions only, like death in custody or death in prison. If a person dies in custody, means person dies in police protection, or person dies in a mental hospital, or the person dies in a juvenile home. Wherever you are under the custody of law, protection of law, supervision of law, that is death in custody. So it's not just prison, it's also a broader term which involves wherever you are under the supervision of law. Mental hospital, juvenile home, you are under the supervision of law. Death in custody, inquiry has to be done by a magistrate. Which magistrate? Judicial magistrate. Death in custody, inquiry is done by a judicial magistrate. Rape in custody, again inquiry is done by a judicial magistrate. So when I say rape in custody, I mean to say all these places, that is maybe prison, maybe a juvenile home, maybe mental hospital, etc. Dowry death, inquiry is done by magistrate. Which magistrate? Executive magistrate. Dowry death, inquiry is done by executive magistrate. And what is the term used for digging out a body from grave? Exhumation. In exhumation, again, inquiry is done by a magistrate. It is done by executive magistrate. These are the main conditions where a magistrate does inquiry: custody, death in custody, rape in custody, dowry death, and exhumation. Next. While exhuming a body from grave, you are supposed to preserve soil which is in contact with the body to detect poisons like arsenic. Again, a very important MCQ. They very commonly ask you, you take out a body from grave, what poison do you expect to find in that body? You expect arsenic to be found in the body. And what do you call this phenomena? Postmortem? Imbibition. Postmortem imbibition. After death, when you bury a body in soil, this body tends to imbibe the poison that is present in the soil or absorb the poison from the soil. It is happening after death. You are calling it post-mortem, right? Post-mortem imbibition, the poison gets absorbed after death. Most common poison that you detect in this is arsenic. Exhumation, again I have told you, inquiry is done by executive magistrate. Next. What is the power of a first class judicial magistrate? What is the maximum imprisonment that it can give? 3 years. First class magistrate, this is the most common magistrate that is asked in your exams. The first class magistrate can send a person to maximum for 3 years in prison. And the maximum fine that he can give is 10,000 rupees. Maximum jail is 3 years, maximum fine is 10,000 rupees, the first class magistrate. Suppose, for the punishment of rape, the minimum sentence is 10 years. The maximum sentence is death sentence. Who would be the magistrate who will try the case of a rape accused? Who will try a rape case? Can a first class magistrate try a case of rape? No. Why not? Because he can give maximum punishment of 3 years. But the maximum punishment for a case of rape is death sentence. Right? So it would not be justice if you bring a rape accused in front of a first class magistrate who will maximally sentence the person for 3 years. That is the reason why we need to know different punishments which are given by different judges, different magistrates. In your exam, most commonly what is asked is first class magistrate. A case of rape would be tried by which court? Sessions court. The lowest court that can pass a death sentence is the Sessions court. So if someone asks you who can try a case of rape, then the answer should be Sessions court because it can give a death sentence. Right? Next. In the court, you need to know there are different people in the court. You need to know what is the term that are used for different people. So, what is the term used for the person who files a case in the court? Complainant or plaintiff. A person who files a complaint is a complainant, who is also known as a plaintiff. Who is the lawyer who fights the case on behalf of the plaintiff? Prosecutor. You beat me. I will file a case in the court. I would be termed as a plaintiff. I will hire a lawyer to fight my case. That lawyer is a prosecutor. I will file a case against you because you beat me up. You will be known as accused. Person who is accused of a crime is an accused. Who tries to defend himself? No, the accused tries to defend himself, tries to protect himself. That is why he is also known as defendant. Accused tries to defend himself. That is why he is also known as defendant. He is trying to defend himself. And this defendant, you will also be hiring a lawyer because you don't have the knowledge of law. So what would your lawyer be known as? Defense lawyer. Lawyer fighting the case on behalf of the defendant is a defense lawyer. In the court, you want to prove your case. I want to prove your case, my case. If I want to prove my case, I would be bringing some evidence. I would be asking some witness to come to the court to give evidence. My lawyer would be asking questions to my witness. What are those examinations known as? Those questions known as? Examination in chief and re-examination. There are two examinations which can be done by a prosecutor, my lawyer to my witness. The first one is examination in chief and the second one is re-examination. both these questionings, both these examinations are being done by the prosecutor to the witness. I call a witness, my lawyer is asking questions to my witness, that is examination in chief and re-examination. First there is examination in chief, next your lawyer would be asking questions to my witness, that would be cross-examination. Your lawyer is the defense lawyer, your lawyer would be doing cross-examination. And then again, my lawyer would be doing re-examination. So my lawyer does two examinations, one is examination in chief and second is re-examination. Your lawyer will be doing cross-examination. Leading questions, what are leading questions? Answers can be given in yes or no. Leading questions are the questions for which answers can be given in yes or no. A witness is coming to the court, we are asking the witness, was this pen used for killing Mr. A? Answer can be given in yes or no. That is a leading question. Leading questions are allowed in only in cross-examination. Again, a very important MCQ, leading questions. Leading questions are questions which can be given, which can be answered in yes or no. They are allowed only in cross-examination. Next, giving false evidence under oath is known as perjury. Giving false evidence under oath is known as perjury. It is defined under which section of IPC? 191 IPC. Talks about the definition of perjury. And which section punishes perjury? 193 IPC. Again, an important MCQ for your exam, perjury. Almost every alternate year you have a question based on perjury. It is defined in 191, punished in 193. It is giving false evidence under oath. Next, a document that is issued by a judge to call a बहुत लड़ाइयाँ इसी चक्कर में होती है कि बहुत लोग जी मैं तो पिछली बार भी इसी आई कार्ड पे एग्जाम दिया था, मैं इस बार भी इसी आई कार्ड पे एग्जाम दे रहा हूँ, मैं तो पिछली बार भी ये ज्वेलरी पहन के गया था, मैं तो अब की बार भी ज्वेलरी पहन के जाऊंगा, एसेट्रा एसेट्रा, चाहे वो कढ़ाई क्यों ना हो, प्रेफरेबली यू शुड रिमूव ऑल दैट. ठीक है, टेप कर देते हैं बट प्रेफरेबली यू शुड रिमूव इट एंड ट्राई टू रीच योर एग्जाम सेंटर ऑन टाइम. लास्ट मिनट हैसल्स मत रखना. एंट्री ठीक है, आप लास्ट मिनट पे ही लेते हो, आई एम प्रीटी श्योर अबाउट इट. सो वो मैंने देखा भी, हम चिल्लाते रहते हैं कि भाई अंदर आ जाओ, आप लोग अंदर नहीं आते हो. दैट इज ओके, कोई प्रॉब्लम नहीं है, बट एग्जाम हॉल पे टाइम से पहुंचना है, दैट इज रिक्वायर्ड, दैट इज इंपॉर्टेंट. नेक्स्ट, सो द फर्स्ट law of insanity is McNaughton's rule. There are a few other laws of insanity. Again, they are asked in your exams. Durham's rule. Next, Curran's rule. Durham's rule, Curran's rule. Irresistible impulse test. Irresistible impulse test. And fourth, American Law Institute test. Normally MCQ के अंदर they ask you like this, which amongst the following is a law of insanity? So they'll be saying McNaughton's, Durham's, Curran's, irresistible impulse institute test. Next, section 304A IPC talks about death due to negligence. Remember, any negligence which is causing death is punishable in 304A. You are not punishable for murder. A doctor is not punished for murder when he is acting in his professional capacity. Doctor would be punished under 304A, negligence causing death. Dowry death, 304B IPC, death within how many years of marriage is dowry death? 7 years. Death within 7 years of marriage is dowry death. And section 320 IPC, which talks about grievous hurt, again very important for your exam. 320 IPC. There are 8 clauses of grievous hurt. The first clause is emasculation, which means impotency. Any injury, if it causes impotence, we say that is grievous hurt, emasculation. What is impotency? Inability to perform intercourse, that is impotence. Any injury, if it causes inability to perform sexual intercourse, then we say that injury is causing emasculation, that is impotency. Second, permanent privation of the sight of either eye. Privation means damage. Permanent means an injury which cannot heal by itself spontaneously. Remember, what happens after surgery is irrelevant. Whether after surgery the patient recovers or not, that is irrelevant. An injury which does not heal spontaneously is a permanent injury. You hit a person on the eye which causes a large corneal opacity, which can be healed by surgery, but it cannot heal spontaneously. Then is that grievous hurt? Yes, because it cannot heal by itself spontaneously. Third, permanent privation of the sight of either eye, permanent privation of the hearing. This has been mentioned incorrectly, please change it. Permanent privation of hearing of either ear. I hit a person on the ear which causes a very small tympanic membrane perforation. Is it grievous hurt? What is the treatment that you do for a very small perforation? Nothing, heals spontaneously. A small perforation, not grievous hurt. A large perforation would be grievous hurt. Next, privation of member or joint. Privation means damage. Member means a part of a body which has a separate function. Any part of a body which has a separate function is a member of the body. Like fingers are the members of the body, ligaments are the members of the body, ear pinna is a member of the body, it has a separate function. Hair, are they considered members of the body? No. Nails? No. Hair and nail, they do not have any separate function in a human, they are not considered members. Next, destruction, permanent impairment of power of a member or joint. Power is obtained from nerves, vessels. You cut the nerve of an individual, you cut the vessels of an individual, you are causing grievous hurt because you are impairing the power. You cut the nerves, you will not be able to move your fingers, right? Power. Next, permanent disfigurement of head or face. Two females are standing in front of me. One is a 20 years old model, the other is a 70 years old aged lady. I shave off the head of both these females. Which is grievous hurt, the model or the aged lady? None. You have cut the hair. It's not a permanent disfigurement, it would regrow, right? It has to be permanent, means cannot heal by itself spontaneously. Fracture, dislocation of bone or tooth. Any fracture dislocation is grievous hurt, and any hurt which causes a threat to life or which causes severe bodily pain for 20 days or the person is unable to follow ordinary pursuits, that is grievous hurt. What do you mean by ordinary pursuit? Daily activities. Daily routine activities are ordinary pursuit. You are not able to get up in the morning, not able to go to the washroom, not able to take bath, means you are not able to do ordinary pursuits. That is grievous hurt. Tell me whether the statement is true or false. Admission to hospital for 1 month is grievous hurt. True or false? False. The requirement is not admission to hospital, the requirement is severe bodily pain. I slap a person, you own a hospital, you admit yourself in your own hospital. Stay there for 1 month, get yourself discharged and say that one slap was grievous hurt. Then was the slap grievous hurt? No, the requirement is not admission to hospital, it is severe bodily pain. Next. Section 375 IPC talks about the definition of rape. What is the age of consent for sexual intercourse? 18 years. Age of consent for sexual intercourse is 18 years. A person below 18 cannot give consent for sexual intercourse. Section 376 talks about the punishment for rape. Punishment for rape extends from 10 years, which can go up to life. It can also be death. 10 years to life, usually. In certain cases, death sentence can also be given. So if someone asks you what is the maximum punishment that can be given for the crime of rape, the answer should be death sentence. Next. Section 53 CRPC talks about the medical examination of rape. We make use of Lugol's iodine test. Lugol's iodine test for examining the rape accused. Sorry, in this blank we should have written accused, medical examination of rape accused, and then the test that you use is Lugol's iodine test, which detects the presence of vaginal epithelial cells. Right, thoda sa upar niche ho gaya. Medical examination of rape accused, and the test is the Lugol's iodine test. It detects vaginal epithelial cells. Question was asked in your NEET exam last year. So normally we expect questions which are coming in NEET, they may be expected in your FMG exam also, related questions. Right? So that is why I am telling you this, section 53 CRPC. Section 164 CRPC talks about medical examination of rape victim. A rape accused is examined under 53 CRPC. A rape victim is examined under 164 CRPC. Victim above what age can give consent for medical examination? Victim above 12 years of age can consent for examination under this section. To examine a rape victim, we make use of 1% toluidine blue. To examine the rape victim, we make use of 1% toluidine blue. This is used to detect micro lacerations. The lacerations which you are not able to see with naked eye, those lacerations can be detected using 1% toluidine blue. Next. Natural sexual offences, what are they? Just a moment. Natural sexual offences means the offences of rape, adultery and any other natural offence that you know. Incest. Rape, adultery and incest. All these are natural sexual offences. What is incest? Sexual intercourse between blood relations, that is incest. Blood relatives or family. Is it punishable in India, incest? No, it is not punishable in India. After marriage, two individuals between a family, they can perform sexual intercourse if it is happening with consent. Next, unnatural sexual offences. Bestiality means intercourse with animals. Bestiality means intercourse with animals. Then there is buccal coitus, which is also known as sin of Gomorrah, which means what intercourse? Oral intercourse. And sodomy means Anal intercourse. Bestiality is intercourse with animals, buccal coitus oral intercourse, and intercourse with animals, that is sodomy. Next, sexual perversions, they are very important for your exams. Very commonly they ask you about sexual perversions. Sexual perversions are also known as paraphilias. These are conditions where a person obtains gratification without performing intercourse. There is no intercourse happening, but the person obtains the same sense of pleasure that he would have obtained after intercourse. Then you call that perversion. Like, person obtains pleasure by inflicting pain to partner. What do you call that? Sadism. Pain to self? Masochism. There is an object of desire. Fetishism. There is an object of desire. You desire any inanimate object. There can be a desire for pen, paper, undergarments, magazine, shoes, anything. As soon as you catch hold of that object, the person obtains a sense of sexual gratification. That is fetishism. Excessive sexual desire in males is known as satyriasis. In females, it is known as nymphomania. Excessive sexual desire in males is satyriasis. In females, it is nymphomania. Pleasure obtained by displaying private parts in public? Exhibitionism. You are exhibiting the private parts, that is display of private parts. Question was asked in your NEET exam last year. There's a person who is sitting in his balcony, naked, overlooking a crowded park, drinking coffee. So what paraphilia does this person manifest? Exhibitionism, display of private parts in public. Masturbation in public is also a kind of exhibitionism, display of private parts in public. Pleasure obtained by watching others perform intercourse? Voyeurism. Person obtains pleasure by watching people perform intercourse. Pleasure obtained by rubbing against private parts of people in public? Frotteurism. Rubbing, there is an R. Frotteurism, also you have an R. Fro. Fetishism, there is no R. In fetishism, there is an object of desire. Frotteurism, pleasure obtained by rubbing. Wearing clothes of opposite gender? Transvestism, which is also known as eonism. Again, it is very commonly asked, what is the other name for transvestism? It is also known as eonism. Next, a juvenile child or minor is a person below what age? 18 years. Any person below 18, irrespective of gender, is termed as a juvenile. Next, that is about the legal part. Next, identification. What is the term used for the body of offense or the essence of crime? Body means corpus. Crime means delicti. Corpus delicti, that is body of offense or the essence of crime. You need to identify people. You identify people by different things, different mechanisms. You go to a crime scene, you find a blood stain, you find a seminal stain, you find hair. At some place you may find bones. You want to identify a number of things. The first thing in identification is determining species. Whether the person, the stain belongs to human or it belongs to animal. For that you make use of precipitin test. It is a species identification test. Next, you can also calculate medullary index from the hair. This index is less than 0.3 in humans or animals? Humans. Medullary index is less than 0.3 in humans. It is more than 0.5 in animals. First is you determine species. Second, you determine race. Race is determined from the skull. What is the index you calculate from the skull to determine race? Cephalic index. Again, commonly asked in your exam, cephalic index is used to determine race. It is the ratio of the maximum breadth of the skull divided by the maximum length of the skull into 100. Indian skull is mesocephalic. Indian skull is mesocephalic. What is the cephalic index of Indian skull? 75 to 80. Which is the best bone for determining gender? Pelvis. Best bone for determining gender is pelvis. This is the third thing that you do in identification, determining gender. Best is pelvis. If you want to determine gender from sternum, which rule do you use? Ashley's rule. Ashley's rule is used to determine gender from sternum. Fourth step in identification, determining age. Age of a person can be determined from three methods: secondary sexual characters, teeth and ossification centers. Secondary sexual characters, you have a sexual maturity rating which was given by Tanner. There is a Tanner's sexual maturity rating which talks about the development distribution of different secondary sexual characters. Development of beard, mustache, body hair, development of breast, genitalia, all that is covered in Tanner's sexual maturity rating. Next, we determine age from the teeth. There are two types of teeth. There is temporary dentition, there is permanent dentition. In temporary dentition, the dental formula is 2102. There are two incisors in one quadrant. So total in one jaw, there is 4 incisors. There are 2 canines in the whole jaw. So one quadrant, it becomes 1 canine. There are 0 premolars in temporary teeth. And there are 2 molars in one jaw. So one side. So total jaw, it has 4 molars. Dental formula is 2102. 4 incisors, 2 canines and 4 molars. Permanent teeth, dental formula is 2123. There are 2 incisors, 1 canine, 2 premolars and 3 permanent molars. In each jaw you have 4 incisors, 2 canines, 2 premolars and 4 molars. Eruption of permanent teeth, question was asked in your NEET exam recently. That is the reason why I have given all these ages. First molar appears at 6, central incisor 7, lateral incisor 8. First premolar appears at 9. Second premolar 10. Second molar at 12. And third molar at 13. In children, you have mixed dentition, that is, you have both temporary and permanent teeth in the oral cavity. This is normally seen between the age of 6 to 12. Next, Gustafson's method. This is used in people above 21 years of age. There are 6 criteria in Gustafson's method. They ask you which is the criteria for Gustafson's method. Secondary dentine, cementum apposition, root resorption, attrition, paradentosis and root transparency. The most reliable criteria is root transparency. The third method of determining age is by the ossification centers. Which is the first ossification center to appear? Clavicle. The first ossification center to appear is the clavicle. Which center corresponds to the period of viability? Talus. The center for talus corresponds to the period of viability. During post-mortem examination, if you are able to find the center for talus, that means the fetus is a viable fetus, capable of a separate existence. What is the period of viability in India? 28 weeks. Period of viability in India is 28 weeks. Next, lower end of femur appears at just before birth. It appears at 9 months intrauterine life. And the upper end of tibia appears at birth, that is 10 months intrauterine life, or at birth. Femur appears at 9 months, upper end of tibia appears at birth or 10 months. These synonyms are very important for your exam. Wherever I have given you synonyms, those synonyms need to be remembered. Dactylography, fingerprinting, Henry Galton system, or dermatoglyphics. What are the most common type of fingerprints? Loops. Most common type of fingerprints are loops. INSET exam you were asked fingerprints develop at what age? 12 to 16 weeks intrauterine life. Fingerprints develop at 12 to 16 weeks intrauterine life. How many points should match in a fingerprint for us to say fingerprint is a match? 8. 8 points should match for us to say fingerprint is a match, and the pattern of prints is different even in identical twins. That is the reason why it is better for identification purposes as compared to a DNA print. A normal print is better as compared to a DNA print because it is different even in identical twins. And print of what fingers are not taken? Small fingers, little fingers. Print of your little fingers not taken while taking fingerprints. Next, what is the term used for the study of pores present on the epidermal ridges? Name used for that technique. Poroscopy. Poroscopy is the study of pores present on the epidermal ridges. On your fingers you have ridges, on these ridges you have pores. That is, the study of those pores is poroscopy. This was developed by someone who is also famous for exchange principle. This is Locard. Locard has developed poroscopy. Locard has also developed exchange principle. Next, the study of lip prints is known as chiloscopy. Study of lip prints is chiloscopy. Study of prints from palate is known as palatoprints. And reugascopy. Study of palate prints, reugascopy, or palatoprints. What is the technique that is used to identify the X-ray with a photograph? Superimposition. Superimposition is a technique for identifying the persons whose skull you have found and a missing person's photograph. You need to compare them. You make use of the technique of superimposition. Next, tattoo marks. Faded tattoo marks can be made visible by UV light. Infrared photography can be used to make an old tattoo visible in a living individual. Besides that, if you want to detect an old tattoo on post-mortem examination, then you examine lymph nodes. Lymph nodes are examined to diagnose the presence of old tattoo during post-mortem examination. A commonly asked question. Next, thanatology. Study of what in all aspects is known as thanatology? Death. You all would have seen Avengers, in that you would have seen Thanos. Thanos simply snapped his fingers and he wiped off half the world's population. Means he had power over death. Thanos is death. Study of death is thanatology. What is not written in death certificate? Mode or manner of death? Mode of death is not written in a death certificate. A very important MCQ for your exams. Mode of death means coma, syncope, asphyxia. They should not be written in death certificate. You should be writing the manner. What do you mean by manner? Whether the death is natural or unnatural, that is manner. Manner should be written, mode should not be written. Immediate post-mortem changes, insensibility, loss of voluntary power, cessation of respiration and cessation of circulation. Early post-mortem changes, pallor, loss of elasticity of skin, eye changes, algor mortis. What do you mean by algor mortis? Cooling of the body. Cooling of the body after death is algor mortis. It is an early post-mortem change. Livor mortis is also known as PM staining, hypostasis, then suggulations. Cadaveric lividity. Hypostasis, staining, suggulations, cadaveric lividity. Again, all these synonyms are very important for your exams. Next, rigor mortis is also known as cadaveric rigidity. There is a stiffness of the muscles after death, that is rigor mortis. Late post-mortem changes, these include putrefaction, adipocere and mummification. Eye changes. Which is the earliest eye change? Loss of intraocular tension. Decrease in intraocular tension, that is the earliest eye change. Decrease in the ocular pressure, intraocular tension. Rise of potassium ions are seen in vitreous. This is the most important biochemical change which is happening after death. Rise of potassium in vitreous. And after death in the eyes there is Kevorkian sign, that is trucking of the blood in the blood vessels. Cattle trucking. Algor mortis, we've already talked about it, cooling of the body after death. The curve of cooling has what shape? Sigmoid shape. The curve of cooling has a sigmoid shape. Best place to record the body temperature after death is rectum. Best place to record the body temperature after death is rectum. Normally, the body temperature remains constant for some time after death. There are certain conditions, however, where the body temperature may rise after death. Those conditions, that phenomena is termed as post-mortem caloricity. In this, the body temperature rises for 1 to 2 hours after death. This can be seen in deaths associated with strychnine poisoning, septicemia, and heat stroke. In your NEET exam this year, you had a question, PM caloricity is seen in what? Septicemia was one of the options. Strychnine, septicemia, heat stroke. Next. Hypostasis or livor mortis, it is the gravitation of blood in the dependent parts of the body. In stagnant water drowning, hypostasis first seen in face. Stagnant water drowning, normally the head is gravitating down, whereas the rest of the body is usually floating up. Face being an area which has a lot of space to accumulate blood, blood tends to gravitate and accumulate in the region of the face. Stagnant water drowning, hypostasis first in the face. In hanging, you have a glove and stocking distribution. Whatever is the dependent part, there you see postmortem change. So hanging, dependent part would be hands and the lower limbs. Color of hypostasis, very commonly asked in your exams. Different poisonings, the color may change. Cherry red, seen in carbon monoxide poisoning. Brick red, cyanide poisoning. Bluish green, hydrogen sulfide, H2S poisoning. Very frequently asked, very important topic, color of hypostasis. Next, rigor mortis, also known as cadaveric rigidity, that is the stiffness of the body. It first develops in heart. Always remember, whenever they are asking you first seen in, first develops in, first involves, the answer should be heart, involuntary muscles. Amongst voluntary muscles, rigor mortis first affects the eyes, followed by the neck, then rigor affects the eyes. Next, start with the neck and move up. Neck, jaw and face. Rigor moves down, chest, upper limbs, abdomen, lower limbs. That is a sequence of progression of rigor. First eye, after that neck and move up. So neck, jaw and face, chest, then upper limbs, abdomen and lower limbs. That is a sequence of progression of rigor. Differential diagnosis. Anything which causes a stiffness of the body would be a differential diagnosis. Heat stiffening, that is because of heat. The muscles may coagulate because of heat. This is usually seen when the body temperature is above 65 degrees Celsius. Cadaveric spasm or cataleptic rigidity or instantaneous rigor, it is again a very important differential diagnosis, and it's a very important MCQ that is asked in your exams. It is seen in what muscles? Voluntary muscles or involuntary muscles? Voluntary muscles. Cadaveric spasm does not affect the heart, it does not affect the involuntary muscles. In cadaveric spasm, there is no primary flaccidity, means immediately after death, the body becomes stiff, contracted. Later, it passes into rigor and later it passes into secondary flaccidity. Normally, in rigor mortis, what happens is, after death, the body is relaxed. Then after some time, the muscles become contracted, and then again after some time, they become relaxed. Relaxation, that is primary flaccidity. Contraction, that is rigor, followed by secondary flaccidity. In cadaveric spasm, there is no relaxation immediately after death. Muscle contracted remains contracted after death. Seen whenever the person is in a high emotional state at the time of death. Person drowns in water, he may clutch at grass and weeds. Muscle contracted may remain contracted. Person trying to commit suicide, a group of muscle contracted may remain contracted. That is cadaveric spasm. No primary flaccidity is seen. It is always antemortem, can never be produced after death. Next, putrefaction. Most important organism responsible for putrefaction is Clostridium welchii, which produces the enzyme lecithinase. The first internal sign of decomposition is reddish discoloration of aortic intima. The first external sign is some discoloration, right iliac fossa. What discoloration? Color? Blue or green? Green. Greenish discoloration of the right iliac fossa is the first external sign. It happens because of sulf-methemoglobin. It is seen because of cecum, because anatomically cecum is seen in the right iliac fossa. It has maximum organisms, seen in about 12 to 18 hours of death. This color change that you are seeing in this right iliac fossa, this is the first external sign of putrefaction. Next, marbling. Greenish discoloration of the walls of blood vessels seen because of sulf-hemoglobin in 36 to 48 hours of death. This greenish discoloration that you are seeing over the chest wall, complete vascular network would be seen. That is marbling. Very important question for your FMG exam, marbling. Next. In putrefaction, you see false blisters. You call them false because they do not contain any fluid. They contain air. Liquefactive necrosis is seen in putrefaction in about how much time of death? 5 to 10 days. Liquefactive necrosis seen in 5 to 10 days of death. This is the order of putrefaction that you need to remember. Larynx, spleen, brain, heart, kidney, prostate or non-gravid uterus, skin, bone and teeth. Next. There is a Casper's dictum which talks about the rate of decomposition. Remember, decomposition is fastest when the body is in air and slowest when the body is buried in soil. Adipocere, a term used for saponification of fats. What is the atmosphere that is required for adipocere to form? Cold and moist or warm and moist? Warm and moist. Adipocere has an ammoniacal, cheesy or sweet odor, and it usually takes about 3 months to 6 months for adipocere to develop. This is how adipocere looks like. In an image, if you would be getting a white or a yellow colored appearance of the body, a little fatty means a little swollen, fatty, and it is possible that the skin may be crumbling because it's wax-like. So just like a wax may crumble, it is possible the skin also may crumble. That is adipocere, white, yellow, fatty, crumbling appearance. Mummification, the body becomes dried or shriveled. Desiccation or drying of tissues is mummification. It usually requires a dry and hot atmosphere. Mummified body is odorless, important MCQ for your exams, and it usually takes about 1 year for a body to mummify. This is how a mummified body looks like. The body would be dried, shriveled, something like dry gangrene. You are not seeing any blister, you are not seeing any bloating, you are not seeing any marbling, no greenish color change is seen. This is mummification. And lastly, entomology is the study of insects. Next, injuries. What are the injuries which can be caused by blunt weapon? Abrasion, contusion and laceration. Along with that, stab wound can be caused by both blunt as well as sharp weapon. A stab wound is a wound where which dimension is more than the length or breadth? Which dimension is more than the length or breadth? We say it is stab. Deep. The depth of the wound should be more than the length or breadth. With your pen, you stab an individual, you cause a wound which has a greater depth as compared to length or breadth. Fishtailing is seen in a stab caused by single-edged weapon or double-edged weapon? Single-edged weapon. A single-edged weapon is a weapon which has one edge as blunt, the other edge as sharp. You stab a person using a single-edged weapon, the result would be a wound which has one angle as blunt, the other angle is sharp. The shape of the wound would be something like this. This shape resembles the tail of a fish, and that is why this shape is known as fishtailing. It is seen in a stab caused by a single-edged weapon. Next, Japanese method of suicide is known as harakiri. Harakiri, it is a Japanese method of suicide. Next, abrasion. Abrasion is an injury which damages only the epidermis. A very important MCQ for your exam. Abrasion damages only the epidermis. A large abrasion over the face, will that be grievous hurt? No. Abrasion is an injury which damages only the epidermis, means it heals spontaneously without permanent disfigurement. So remember, abrasions are never grievous hurt except at one place. Which is that place? Eyes, cornea. Only corneal abrasion is grievous hurt. Otherwise, abrasions are never grievous hurts. Next, type of abrasions. Scratch or linear abrasion. Graze abrasion is most commonly seen in road traffic accident. This abrasion that you are seeing in this image over the body, this is a graze abrasion. Most commonly seen in road traffic accidents or roadside accidents. Pressure abrasions are caused by continuous pressure. You apply ligature over the neck and you hang yourself. The resulting ligature mark would be pressure abrasion. Very commonly they have asked you, bite mark is what kind of abrasion? Again, pressure abrasion, it is because of continuous sustained pressure. And last, impact or imprint abrasion, where there is a component of velocity, something is in motion. Patterned abrasion is an abrasion where the pattern of the object is seen over the skin of the individual. Next, contusion or bruise. This is the extravasation of blood in the surrounding tissues with intact epithelium. Again, a very important definition. In your exam, they usually stick to the basics. Basic definition, basic procedures, basic things. That is usual. Of course, that is almost 60% of your syllabus. The remaining 40%, 20% would be something where they are expecting something very much, and 20% would be again average. So 60% is basic, 20% is something which is a little average, and 20% would be on the higher side, right? So these are basics, definitions. What is a contusion? Epidermis intact, but the underlying structure is damaged. A bruise anywhere over the body is never grievous hurt. Ectopic bruise is a bruise which is seen away from impact. You hit at some place, but you're getting a bruise at some other place. What is a bruise? Where you find contusion in the periorbital region due to fracture of anterior cranial fossa. Ectopic bruise, what is the name given to that sign? Raccoon sign. Raccoon sign is seen in fracture anterior cranial fossa where contusion is seen around the eyes. What is the contusion seen over mastoid in fracture middle cranial fossa known as? Battle sign. Battle sign. The first one is raccoon sign, contusion around the eyes. The second one is battle sign, there is contusion over the mastoid. Next. Again, basics. Difference between laceration and incised wound. In a laceration, you take a blunt weapon, you hit a person with a blunt weapon, because of which the epidermis is damaged, the underlying structures get damaged. They get damaged and they get crushed because it is a blunt weapon, a stick. In contrast, in an incised wound, you have a sharp weapon. With that sharp weapon, you cause a cut over the skin of the individual. So anything which is deeper would be cut. In a laceration, things are crushed because it is a blunt weapon. In a sharp weapon, the things are cut because it is a sharp weapon. Laceration, it has irregular margins. Incised wound, it has regular margins. In laceration, the tissues are crushed. In incised wound, the tissues are cut. In laceration, the bleeding is less, whereas in incised wound, bleeding is more. And tissue bridges are present in a laceration, they are absent in an incised wound. Tissue bridges means intact nerves and fibers. Like for example in this image, the second image. You hit a person with a blunt weapon, the nerves are left intact. That is tissue bridges, intact nerves. In contrast, if you have a knife and you cut the skin of an individual, everything would be cut. This nerve would also be cut. It would not be spared. Tissue bridges are present in a laceration. They are absent in an incised wound. Next. Lacerated looking incised wounds. They are seen over scrotum and axilla. Incised looking lacerated wounds are seen over bony prominences. What is this wound over here? Incised or lacerated? Lacerated. You are able to see irregular margins over the skin of the individual. Along with that, you are able to see tissue bridges. This is a laceration, but it appears like an incised wound. Incised looking laceration. Hesitation cuts are seen in suicide. Defense wounds are seen in assault or homicide. Avulsion laceration is also known as flaying. In this, the skin and the subcutaneous fat are separated from the underlying fascia. It is possible a tire passes over your skin. At that time, your skin gets entangled with the tire treads, because of which, as and when the tire will move over your body, your skin would be pulled along with the tire. That is avulsion laceration. Next, skull fractures. The most common skull fracture is linear or fissure fracture. Depressed fracture is also known as signature fracture. Pons fracture is seen in children, infants. Gutter fracture is seen in bullet injuries. Comminuted fracture, it has a spider web appearance where multiple fracture lines would be seen radiating out from a common point, giving the appearance of spider's web. Comminuted fracture. Motorcyclist or hinge fracture is a fracture affecting the base of skull where the base of skull gets divided into two halves, anterior and posterior. And ring fracture is seen in fall from height where there is a fracture seen around foramen magnum. Ring fracture. Next, EDH. Most common cause for EDH is damage to the middle meningeal artery. Lucid interval is present in EDH. In lucid interval, the person is responsible for the crimes done. This is how EDH looks like. Now in an image, if you want to determine whether it's EDH or SDH, then you should always try to look for Salkai Gairai. If you are not able to see Salkai Gairai, that means they are covered by a membrane, and that membrane would be the dura mater. You are getting hemorrhage outside dura mater, that becomes EDH. Right? Always try to look for Salkai Gairai. In this image, are you able to see Salkai Gairai? Yes, means they are not covered by a membrane. If you see any hemorrhage after removal of dura, then that becomes SDH, subdural hemorrhage. EDH is arterial hemorrhage, SDH is venous hemorrhage. SDH is because of the damage to the cortical bridging veins. Next. Thermal injuries. In thermal injuries, you should know how to calculate the burnt area. In this, you need to know there is a Wallace's rule of 9 which talks about distribution of burnt area, different distribution of body surface area to calculate the burnt area. Head and neck is given what percentage? 9%. Front of chest is given 9%, front of abdomen is given 9%. Back of chest is given 9%, back of abdomen is given 9%. Upper limbs are given 9% each, front and back, total 9%. Front of right lower limb 9, front of left lower limb 9, back of right lower limb 9, back of left lower limb 9. And 1% is given to the genitalia. Different body parts are given 9%, 1% given to the genitalia. Next. To say whether a burn injury is antemortem or not, antemortem means the person was burned when he was alive, before death. That is antemortem. Postmortem means after death. To see whether, to determine whether a burn injury is antemortem or not, you need to look for certain features. First, if there is presence of soot and trachea, that shows antemortem. If the level of carboxyhemoglobin is more than 5% in a non-smoker, more than 10% in a smoker, then that shows antemortem. If there is any sign of healing, if there is vital reaction, then again that shows antemortem. Next, cause of death. What is the most common immediate cause of death in burns? Shock. Which shock? In all three there is shock. Immediately it is neurogenic shock. Most common immediate cause of death is neurogenic shock. Less than 48 hours, which shock? Hypovolemic shock. Hypovolemic shock. And more than 48 hours, septic shock. Immediate neurogenic shock, not an option, carbon monoxide poisoning. Less than 48 hypovolemic, more than 48 septic. Next. This first image is of what burns? Bullous formation or blister formation. This is seen in characteristic of moist burns, which are known as scalds. This first image is of scald burns. Blisters characteristically seen in scalds, moist burns. Burns caused by hot liquids, burn caused by steam are scalds, moist burns. Second image shows you injury due to high voltage current, that is electrocution. What is the name of the burn that is seen in electrocution? Joule burn. Joule burns are seen in electrocution. And the third image shows you burns caused by lightning, they are filigree burns. Filigree burns are also known as arborescent burns or Lichtenberg's flowers. Next. You want a break? So, next is asphyxia. Again, asphyxia, there are certain terms that you need to know. The first one, what do you call this? External compression of nostrils and oral orifice. You call it smothering. Sinichara. Smothering, external compression of mouth and oral orifice. Obstruction of oronasopharynx by a cloth. You push a cloth in the oronasopharynx. What is that? Gagging. And the internal obstruction of the upper respiratory passage is known as choking. Internal obstruction of the upper respiratory passage is choking. From outside it is smothering, gagging, and then there is choking. Hanging is the constriction force on the neck, is a condition where the constricting force on the neck is equal to the weight of the body. What do you call the hanging where the knot is present at the occiput? At the back of the head? That hanging is known as typical hanging. Typical hanging, knot is present at the occiput. Atypical hanging, the knot is present anywhere else except the occiput. At the occiput you have the knot, that is typical. Anywhere else you have the knot, that becomes atypical. What is hanging? Where the body is fully suspended, nothing touches the ground. Complete hanging. Complete hanging, the body is fully suspended, nothing touches the ground. The most characteristic sign of hanging is only hanging. They are asking you, the answer should be ligature mark. Most characteristic sign of hanging is ligature mark. If they are specifically asking you antemortem hanging, then you need to mark your answer as dribbling of saliva or La Fauci sympathetique. In La Fauci sympathetique, there is a compression of the cervical sympathetic chain. Next, strangulation. There are different names given to strangulation based on how you are strangulating a person, how the force is being applied. If the force is being applied using ligature, using a rope, you are compressing the chest, compressing the neck of the individual, then you call that hanging ligature strangulation. Force applied by ligature. Manual strangulation is strangulation by hand, also known as throttling. Throttling. Strangulation using bamboo sticks is known as Banstola. By elbow, mugging. A person is standing, you come behind and you catch hold of the neck in the elbow, then that is mugging. And judicial strangulation is known as garroting. Garroting. Hyoid fracture is most common in which out of all these? Hanging, strangulation, throttling. Throttling. Hyoid fracture is most commonly seen in throttling. Drowning. Hydrocution is also known as immersion syndrome. It is seen in cold water drowning when the person falls in cold water. As soon as he touches the cold water, he dies. That is hydrocution or immersion syndrome. Froth is not seen in hydrocution. Dry or atypical drowning, again the person dies as soon as water touches the larynx. Froth is not seen. Typical drowning, the person drowns in water, falls in water, drowns in water. Death is usually due to arrhythmias. Froth is seen. And near drowning, the person drowns, is rescued, you resuscitate the individual, but he dies at a later time because of complications of aspirating water. That is dyselectrolytemia, metabolic acidosis. Froth is again seen. Most characteristic sign of antemortem drowning is grass and weeds in the hand. Not an option, mark your answer as Pultov's hemorrhages. Not an option, diatoms. Not an option, froth. This is the sequence in which you should mark your answer, the most characteristic sign of antemortem drowning. Last, diatoms are microscopic. What organisms? Algae. Diatoms are microscopic algae. They have a shell that is made of silica. I've already told you, you find diatoms, it is a sign of antemortem drowning. Next, autopsy. Most common incision that you use during autopsy is eye incision. Most common incision in autopsy is the eye incision. Heart is dissected by what technique? Inflow, outflow technique. Heart is dissected by the inflow, outflow technique. Triphenyl tetrazolium chloride is used to detect, to diagnose what in the heart, what condition? MI. Dye used to detect myocardial infarction is triphenyl tetrazolium chloride, TTC. The cardiac cells which are damaged, they do not take up this dye. The intact cells, they take up this dye to give you a color change, right? Next, best preservative for viscera for chemical analysis is? Formalin is never used as a preservative. Best preservative is rectified spirit. Most common is NaCl. Most common preservative for viscera is sodium chloride. Best is spirit. Most common is sodium chloride. Remember, formalin is not used as a preservative for chemical analysis, toxicological analysis. Formalin is used for histopathology. In a case of poisoning, if you want to preserve viscera, then you use spirit. Most common is NaCl. Formalin used for preserving tissues for histopathological examination. And if it is a case of alcohol poisoning, then what is the preservative you use? Sodium fluoride. Sodium fluoride is used in alcohol poisoning. Next. The unlawful killing of a child below what age is termed as infanticide? 1 year. What is the term used for a child who dies in utero? Deadborn, stillborn or liveborn? Deadborn. A dead-born is a child who dies in utero. Intrauterine death happens, you say the child is dead-born. Child dies inside the uterus. There are three features that you need to know in a dead-born child. The first, rigor mortis at birth. Second, mummification. And third, maceration. All these are features of a dead-born child. Mummification, maceration, rigor at birth. Maceration is a term used for aseptic autolysis. Aseptic autolysis means decomposition in an aseptic environment. There is decomposition without organisms, that is maceration. Presence of gas in great vessels is known as Roberts sign. Roberts sign is the presence of gas in great vessels. It is seen in maceration. The first radiological sign of maceration is Roberts sign. Gas in great vessels. Overriding of the bones of vault. This is Spalding sign. Overriding of the bones of cranial vault is Spalding sign. Again a sign of maceration. There are two radiological signs of maceration. The first one is Roberts sign. The second one is Spalding sign. Next. A child who dies during the process of birth is known as a stillborn child. And a child who is born alive is known as a live-born child. So there is a dead-born child who dies in utero, there is a stillborn child who dies during the process of birth, and there is a live-born child who dies, who is born alive and may die at a later time. Right? A child born alive is a live-born child. Features of a live-born child. Hydrostatic test is positive. Hydrostatic test means where you put the lung tissue in water and the lung tissue floats in water. That is hydrostatic test. The lung tissue floats. Breast loss second life test is positive. Breast loss second life test is where there is the presence of air in stomach. And last, the weight of lung increases after respiration. Again a sign of a live-born child. Next, examination of stains. You need to know about examining two types of stains. The first one is blood stains. In blood stains, you do screening test and you do confirmatory test. There are two screening tests that you need to remember. The first one is benzidine, where you get a deep blue color. The second one is phenolphthalein or Castle-Mayer's test, where you get what color with blood? Pink. Pink color with blood. That is phenolphthalein or Castle-Mayer's test. It is an important test for your exams. Confirmatory test. There are two main confirmatory tests. The first one is Heeman or Teichmann's test, in which you get brown rhombic crystals. The second one is hemochromogen or Takayama test, where you get pink feathery crystals. In your FMG exam, you had been given the image of Heeman test and you were asked to identify the test. This is how the Heeman test crystals look like. Brown rhombic crystals. They are seen in Heeman test. It is a confirmatory test for a blood stain. Next, seminal stain. If you expect a seminal stain at some place and if you expose the seminal stain to UV light, you get a blue or a white colored fluorescence. Florence test, you get crystals of choline periodite, and Barberio's test, you get crystals of spermine picrate. Very important tests for your FMG exams. Florence and Barberio's. Florence, you get crystals of choline periodite. Barberio's, you get crystals of spermine picrate. Next, toxicology. Patient of poisoning comes to you, you can do gastric lavage. Gastric lavage is contraindicated in all corrosive poisonings except phenol. Phenol, gastric lavage is indicated, it can be done. Phenol is carbolic acid. In all corrosives, gastric lavage is contraindicated except phenol or carbolic acid where lavage can be done. Why is gastric lavage contraindicated in corrosives? Because there is a risk of gastric perforation. In all corrosives, the stomach wall becomes very thin, because of which slightest of trauma can cause gastric perforation. Except in phenol, where the stomach wall becomes thick. So you can do lavage safely without any risk of gastric perforation. Next, specific poisons. First, arsenic. Fatal dose for arsenic trioxide As2O3 is 0.1 to 0.2 grams. Acute arsenic poisoning resembles which condition? Cholera. Acute arsenic poisoning resembles cholera. Acute arsenic poisoning causes throat pain, vomiting and diarrhea, that is purging. In chronic arsenic poisoning, arsenic accumulates in different parts of the body. That is the reason why when you are doing post-mortem in a case of arsenic poisoning, you preserve all these things wherever arsenic accumulates. Hair, skin, nail, bone. Because arsenic accumulates in the hair, it causes golden hair. It accumulates in the skin, it causes some pigmentation of the skin. What pigmentation? Raindrop pigmentation. Raindrop pigmentation is seen in arsenic. Arsenic accumulates in the nails because of which it causes Aldrich measlines. And arsenic causes black foot disease. In black foot disease you find there is gangrene of the feet. Black foot disease, you find gangrene, there is Aldrich measlines, raindrop pigmentation and golden hair seen in arsenic. Treatment is British anti-leucite, which is also known as dimercaprol. Again, question was asked in your NEET 22 exam, the treatment of choice for arsenic. Next, mercury. Minamata disease was caused by? It was caused by organic mercurial compounds, that is methyl mercury. Minamata disease was caused by consumption of organic mercury, that is methyl mercury. It was caused by consumption of fishes, methyl mercury. Chronic mercury poisoning is known as hydrargyrism. Features include tremors, which are also known as mercurial tremors, Danbury tremors, gingivostomatitis, acrodynia, and there is nephrotoxicity, especially damage to the proximal convoluted tubule. Acrodynia is also known as pink disease. Treatment of choice is again British anti-leucite, that is dimercaprol. Next, lead. Lead, it inhibits heme synthesis. In the heme synthesis, it inhibits two enzymes. One is ALA and the other starts with F. So what enzyme is inhibited by lead? ALA? Synthase or dehydratase? Dehydratase. Lead inhibits two enzymes. The first one is ALA dehydratase. The second one is ferrochelatase. Lead inhibits two enzymes in heme synthesis, ALA dehydratase and ferrochelatase. Chronic lead poisoning is known as plumbism, also known as Saturnism. Features of chronic lead poisoning include anemia. There is basophilic stippling of RBC. There are some lines formed on the gums. What lines? Blue lines. What are they known as? Burtonian lines. There are Burtonian lines, that is blue colored lines which are seen at the junction of teeth and gums. There is colic, constipation, there is encephalopathy, there is facial pallor. Facial pallor is the earliest sign of lead poisoning. Facial pallor is the earliest sign of lead poisoning, and there is pure motor neuropathy which causes foot drop, wrist drop, etc. So if your examiner is giving you symptoms like anemia, they say the patient is presenting to you with encephalopathy with foot drop, then you're talking about lead, the answer has to be marked accordingly. Treatment of choice. For mild poisoning, that is, if the blood lead level is less than 35 micrograms per deciliter, you administer Succimer, that is DMSA. If the blood lead level is less than 35 micrograms per deciliter, you administer Succimer, that is DMSA. In case of moderate poisoning, that is levels of lead between 35 to 75, you should administer EDTA. And if it is severe poisoning, that is the lead level is more than 75, with or without encephalopathy. Encephalopathy may be there, may not be there. With or without encephalopathy, you need to administer BEL with EDTA. British antileosite with calcium EDTA should be administered in severe lead poisoning. Levels more than 75. Encephalopathy is there or is not there. You need to administer this. Next. Iron. Iron poisoning causes abdominal pain, it causes GI bleed. It is a favored poison in your FMG exam, iron. Along with that, lead is also an important poison for your FMG exam. Treatment for iron poisoning is desferoxamine. Treatment for iron toxicity is desferoxamine. Next, phosphorus. Phosphorus can be of two types, white and red. Which phosphorus is toxic, white or red? White. White phosphorus is the toxic phosphorus. Chronic phosphorus poisoning is known as phossy jaw, which is also known as glass jaw, which is also known as Lucifer's jaw. Phossy jaw or glass jaw or Lucifer's jaw, it is seen in phosphorus poisoning. Next. Abrus precatorius, also known as Rati, Gunchi or Indian licorice. The active principle in Abrus is Abrin, which resembles which venom in action? Viper, which resembles viper venom in action. Abrin resembles viper venom. From abrus you prepare sui. The medico-legal importance, MLI means medico-legal importance, is you make sui from abrus precatorus. Sui means needles. So what you do is you take abrus, along with that you make a number of compounds, you mix them together, you make a paste. From that paste you make 1 to 1.5 centimeter long needles. You take a wooden plank, you insert the needles perpendicularly in the plank, separated by a distance of 2 to 3 centimeters. If you take this plank and if you hit a person with a plank, the two needles enter into the skin simultaneously, creating two marks, resembling fang marks of a snake. The manifestation would also remember viper venom. Therefore, to make a homicide look like an accidental snake bite, you're using sui, abrus. Snakes. There are the big four snakes in India. The first one is Naja Naja, that is a zoological name for cobra. Second, Bungaroo cerulus, the common name is krait, common krait. Third, Viperia russellii, that is Russell's viper. And the fourth one is Equus carinatus, that is saw-scaled viper. Try to remember the zoological names also. They are important for your exams. The venom of cobra and common krait is neurotoxic. Venom of viper is vasculotoxic. Venom of sea snake, musculotoxic or myotoxic. Very important, venom of cobra and krait neurotoxic, venom of viper is vasculotoxic. Next, treatment. There is an acronym known as Do It Right that is used for treatment of snake bite. R stands for reassurance, I stands for immobilization, GH stands for get to hospital, and T stands for tell the doctor. You are not supposed to incise at the site of bite. You need to reassure, you need to immobilize, but wound manipulation should not be done. You should not try and suck out the venom, you should not incise the site of bite, you should not apply a tourniquet, and you should not wash the wound with soap. Because again, if you are washing the wound with soap, you are actually manipulating the wound, which will increase the reabsorption, the absorption of the poison from the skin, the bite site. You need to give TT in every case of snake bite. Polyvalent ASV should be given. ASV should be given only if there are signs of systemic envenomation. You should not give ASV in every case of snake bite. You should give ASV only if you have signs of systemic envenomation, means the snake has injected its venom into your body. Only if you see signs of systemic toxicity, you should give ASV, otherwise ASV should not be given. The starting dose for ASV is 8 to 10 vials. Test dose is not given before starting ASV. Besides that, if it is a case of cobra bite, you need to administer neostigmine. Before giving neostigmine, would you pre-treat your patient with something else? What? Atropine. Pre-treat your patient with atropine. Why? To block the muscarinic receptors, the cardiac side effects of neostigmine, you need to pre-treat your patient with atropine. Next, opium. Opium is obtained from the unripe fruit of the poppy plant. What is the botanical name for poppy plant? Papaver somniferum. Papaver somniferum. Opium is a depressant. It depresses everything. It depresses your secretions, it depresses your respiratory center, it causes drowsiness, pinpoint pupil, coma. Everything gets depressed. The only secretion of the body which is not depressed is the sweating. Sweat. Everything gets depressed in opium poisoning. Every secretion dries up except sweat. Sweating is seen in opium poisoning also. Withdrawal features. Opium is a drug known for dependence. If you stop abusing opium, there would be some withdrawal features. The withdrawal features are usually by default opposite to the features of toxicity. Right? So if opium causes drowsiness, on withdrawal there should be a little excitation. But that is not the case in opium. In opium, drowsiness can be a feature of both withdrawal as well as toxicity. Why? Because opium is a somniferous poison. Even after withdrawal, there would be drowsiness in the body. There would be yawning that a person would be doing, drowsiness. Usually the secretions are depressed. After withdrawal, the secretions are increased. Rhinorrhea. Sweating was there previously also, sweating would be there after also. Treatment of choice. What is the treatment of choice for opium withdrawal? Opium poisoning? Naloxone. Treatment of choice for opium is naloxone. What is the alkaloid in opium? What is the active principle in opium? Morphine. The active principle, the main alkaloid in opium is morphine. So basically when we are talking about opium poisoning, we are talking about morphine poisoning. Treatment of choice, naloxone. Next, heroin is also known as smack, junk or dope. Dhatura contains hyoscine, which is an anticholinergic. Because it is an anticholinergic compound, you get all the features that you see in anticholinergic poisonings. Like there would be dilated pupil, there would be diplopia, there would be dry, hot skin which causes hyperthermia. There would be delirium, dysphagia, dysuria. Many Ds are seen in Dhatura. D for Dhatura, D for many Ds. Treatment of choice. It is an anticholinergic, so you will be giving cholinergic compounds. The best treatment would be physostigmine. Neostigmine does not cross the blood-brain barrier, therefore the treatment of choice is physostigmine. Next, cocaine is white lady or coke. It is obtained from the plant Erythroxylum coca. Cocaine plus what forms speedball? Heroin. Cocaine plus heroin is speedball. Cocaine is again a very important poison for your FMG exam. Chronic cocaine poisoning causes what? Bradycardia or tachycardia? Tachycardia. Remember, cocaine is a stimulant. It is a vasoconstrictor. Because it is a stimulant, because it is a vasoconstrictor, it causes tachycardia. It does not cause bradycardia. Because it is a stimulant, it causes anxiety. It causes increased movements. It causes black teeth and it causes perforated nasal septum. Perforated nasal septum again because it is a vasoconstrictor. You snort cocaine. When you snort cocaine, it causes nasal septal ischemia because it is a vasoconstrictor, resulting in perforation. Black teeth are seen in cocaine poisoning. And cocaine causes formication. Formication is any hallucination involving the insects. Any hallucination which involves insects is termed as formication. Like in cocaine poisoning, you have Magnon symptoms, which are also known as cocaine bugs. There is a feeling of bugs crawling under the skin, that is cocaine bugs or Magnon symptoms. They are seen in chronic cocaine poisoning. They are not seen in acute cocaine poisoning. Treatment of choice, amyl nitrite, diazepam. Next, cannabis, also known as Indian hemp or marijuana. The active principle in cannabis is delta 9 tetrahydrocannabinol, that is THC. What do you get from the dried leaves of cannabis? What preparation do you prepare? Bhang. Bhang is prepared from the dried leaves of cannabis. What is prepared from the flowers of the female plant? Ganja. What is a resin obtained from the stem of the plant? Charas or hashish. Charas or hashish is a resin obtained from the stem. It is the most toxic preparation of cannabis. Run amok is an impulse to kill which is seen in cannabis abuse. Next, Strychnus nux vomica. The active principle in strychnus is strychnine. Strychnine is a spinal poison. It acts on the anterior horn cell of the spinal cord. The characteristic spinal posture that is seen in strychnine poisoning is the backward arching of the spine. What do you call that? Opisthotonus. Opisthotonus is a term used for the backward arching of the spine. There is a bow-shaped spine that you are able to see, backward arching. That is opisthotonus. Treatment of choice is diazepam. Next, methyl alcohol is also known as wood alcohol. It causes abdominal pain, optic neuritis. It is associated with Hooch tragedy. Hooch tragedy is seen in methanol. Usually, illicit liquor has a very high methanol content. There have been instances in the past where this illicit liquor had much higher methanol content. After consuming that illicit liquor, individuals became blind due to optic neuritis. Those tragedies have been known as Hooch tragedy. So if your examiner is giving you blurring of vision, if he is giving you illicit liquor, then definitely he is talking about Hooch tragedy. Treatment of choice is 4-methylpyrazole, which is also known as fomepizole. Treatment of choice is 4-methylpyrazole, that is fomepizole. It is a better treatment as compared to ethanol. Ethanol is a competitive inhibitor for methyl alcohol. Drug of choice fomepizole, not an option. Mark your answer as ethanol, which is a competitive inhibitor. And the last poison, alcohol. In alcohol, there are 3 stages of intoxication. Excitement, which is seen at a blood alcohol concentration of up to 150. In coordination, blood alcohol concentration 150 to 400, and coma, which is seen at a BSE of more than 400 milligram percent. If a patient presents to you with confusion, ophthalmoplegia, ataxia, nystagmus, then what would you diagnose the patient to be suffering from? B1 deficiency causes alcohol complications. That is one, but what is the term given to this condition? Wernicke's encephalopathy. Wernicke's encephalopathy. If your question reads confusion, ophthalmoplegia, ataxia, nystagmus, then you diagnose the patient to be suffering from Wernicke's encephalopathy. If the patient is suffering from amnesia, confabulation, then he's suffering from Korsakov's psychosis. Korsakov's psychosis. And delirium tremens is usually seen in how many hours after alcohol withdrawal? 72 hours. 3 days or 72 hours alcohol withdrawal, there may be delirium tremens. The best test for detecting alcohol is gas chromatography. You can also use Cavett's test. The legal limit of blood alcohol while driving is up to 30 milligram percent. That covers the text. Anything else besides what I have covered that you would like to ask? Any doubt? Anything else? For what? Cannabis treatment is symptomatic. There is no specific treatment for cannabis. So the A, B, C, D, E that you have read, that is what you need to do. Next, we'll start the PYQs. According to MTP Act 2021, abortion is legally allowed up to 24 weeks. MTP Act gives certain grounds for terminating pregnancy. What are the grounds for terminating pregnancy? If pregnancy because of rape, failure of contraception, there are genetic anomalies, or if the mother's life is in danger. If the pregnancy is because of rape, or if there is failure of contraception, then pregnancy can be terminated till 24 weeks. If there are chromosomal abnormalities, or if the mother's life is in danger, then the pregnancy can be terminated anytime. Pregnancy because of rape or failure of contraception, 24 weeks. If there are chromosomal abnormalities or if the mother's life is in danger, pregnancy can be terminated at any time. Up to 20 weeks, opinion of how many doctors is required to terminate pregnancy? One doctor. 20 to 24 weeks, opinion of 2 doctors is required to terminate pregnancy. Up to 20 weeks, 1 doctor, 20 to 24 weeks, 2 doctors. In the present question, the best answer would be up to 24 weeks because any time is not an option. Plus, they have not given the ground for termination. They have just said MTP Act, abortion can be done till. Next, excessive sexual desire in males is known as satyriasis. In females, nymphomania. What is masochism? Beating partner or beating self? Beating self. Voyeurism? Watching people perform intercourse. A physician referred a patient to a radiologist. Some person known to a radiologist later visited the physician doctor with a thank you letter and a money packet. Which is true regarding the situation? This is dichotomy. Dichotomy is fee splitting. You are taking commission for the referral. That is what is signified by the money packet. Always remember, whenever there is a tussle between law and ethics, always priority should be given to law. Law has a priority over any ethical responsibility that you may be having. This particular scenario, it is purely ethics. That is why the answer is medical dichotomy. Suppose there may be a question where we say a doctor has drunk alcohol. Now he is examining the patient, he is operating on a patient. While operating, he injures a vessel. Then, what would be a better answer? Criminal negligence or infamous conduct? It is infamous conduct because he is drunk, like alcohol. It is criminal negligence because he has injured a vessel. What would be a better answer? Both is not an option. You have to mark one, a better answer. Criminal negligence. So whenever there is a tussle, whenever there is a scenario where a doctor can be punished in both law as well as ethics, always mark law as your answer, criminal negligence. Not an option, mark infamous conduct. Can mark both, mark both as your answer. Next, toxicity of venom of king cobra is neurotoxic. Which venom is musculotoxic? Sea snake. Vasculotoxic? Viper, Russell's as well as sawscale viper. A dead body is brought for autopsy. This is the image. What would be the odor in this case? Odorless. This is mummification. In mummification, there is no odor. Adipocere, what is the odor that you get? Sweet or ammoniacal? Ammoniacal odor or sweet odor. Next. Body recovered within a few minutes after death. What is this? Cadaveric spasm. There are grass and weeds in the hand. This is cadaveric spasm. It is always antemortem or postmortem? Antemortem. Can never be seen after death. Autopsy. You are getting the following findings. What is suggestive of? You are getting the lungs. In the lungs you are getting this heart. This heart you are finding there is blood, and along with that you are finding this bluish discoloration. Why? Because there is the pericardium. Just beneath the pericardium you are getting blood. That blood is giving a bluish discoloration to the pericardium. This here is cardiac tamponade. Cardiac tamponade, you find there is blood around the heart which gives a bluish discoloration to the pericardium. The lungs are absolutely normal, but you are getting a bluish discoloration in the pericardium. This is cardiac tamponade. Examination of a stained sample under microscope, you have seen these crystals. What is this test? This is Heeman or Teichmann's test. Next, in Barberio's test you get yellow crystals of spermine picrate. In Takayama test you get pink crystals. So brown crystals are more suggestive of Teichmann's or Heeman test. Next, a 40-year-old patient comes to casualty with history of some unknown poisoning. The attending doctor notices excessive sweating. There is a fall in BP, there is bradycardia. You will treat the patient using atropine. This is a case of organophosphorus compound poisoning. Organophosphorus compounds can act on both muscarinic receptors as well as nicotinic receptors, because of which you may be getting a mixture of symptoms. There may be an increase in body secretions, there may be salivation, lacrimation, urination, defecation, etc. There may be tachycardia, there may be bradycardia, there may be fasciculations, there may be twitching. Every kind of symptom may be seen, receptors both stimulated, muscarinic as well as nicotinic. Treatment of choice, atropine. Lucid interval, most commonly seen with EDH, extradural hemorrhage. Is a person responsible for the crime done in lucid interval? Yes, he is responsible. Next, a chronic alcoholic with a history of 25 years alcoholism suddenly left alcohol after 72 hours. There is some feature, delirium tremens. Is a person responsible for the crime done in delirium tremens? Is not responsible. Delirium is an acute confusional state. In that acute confusional state, the person does not know anything. He does not even have an understanding of what his name is. He does not know anything, let alone having an understanding of what he is doing. Insight is not present. No understanding is there. Therefore, delirium, crime done, not responsible. Any delirium, the crime done is not responsible. Delirium tremens also, crime done, not responsible. Next, patient presents with lacrimation, diarrhea, congested eyes, tachycardia, hypertension. What should you suspect? Everything gets depressed in opium. In withdrawal, everything would be increased. All the secretions are depressed, that is what I told you, except sweating. In withdrawal, every secretion would increase. Everything gets depressed, there is bradycardia, there is drowsiness. But when you talk about opium withdrawal, there would be tachycardia, there would be hypertension. Best answer would be opium withdrawal. Findings of the image, scar formation. Scar is useful for identifying an individual. Scar, useful for identifying. Next, during examination, hair bulbs are noted to be crushed. Probable type is laceration. In laceration, you find crushing. In incised wound, there is a cutting of the tissues, cutting of the fibers. Next, history of cobra bite, there is drooping, there are some signs. What should be the next best thing to be done? Atropine with neostigmine needs to be administered. Neostigmine prevents death by preventing respiratory muscle paralysis. Atropine, we have already talked about it, needs to be given, pre-treatment needs to be given to prevent the cardiac or the muscarinic side effects of neostigmine. A patient with history of substance abuse has been brought to the casualty. Respiratory rate 8 per minute, pulse depressed, BP depressed, pinpoint pupil present. Identify the poisoning. Morphine poisoning. It is opium poisoning. The active principle in opium is morphine. The drug of choice is naloxone. Everything gets depressed in morphine poisoning. Next, opinion of two doctors needed when? 20 to 24 weeks. Next, lead poisoning 60 micrograms per deciliter. Treatment of choice? EDTA. Less than 35? DMSA, that is Saxima. More than 75? EDTA plus BAL. Leading questions permitted in cross-examination. Leading questions are questions for which answers can be given in yes or no. Getting sexual gratification by giving pain to partner is sadism. Beating the partner is sadism. Getting yourself pleasure by inflicting pain is masochism. Lesbianism is female homosexuality. Lesbianism is a term used for female homosexuality. It is also known as tribadism. Female homosexuality is lesbianism, also known as tribadism. Is the individual punishable for this crime? Are the people punishable for female homosexuality? No. Female homosexuality is not punishable in India. What about male homosexuality? Is that punishable in India? Male homosexuality, if it is consensual, it is not punishable. If it is being done with consent, then that is not punishable. If it is happening without consent or with a minor, that is a person less than 18, it is punishable in India. Right? Consensual, not punishable. Next, urolagnia. Urolagnia is when a person obtains gratification by urinating on others or by watching people urinate. So when you obtain pleasure by watching people urinate or by making a person urinate on others or urinating on you, then that is urolagnia. Features of artificial bruise is vesicles. Artificial bruise is a bruise which is not caused by trauma. It is not caused by your blunt weapon. It is an artificial bruise. It is prepared to fabricate evidence. You are making an artificial bruise to fabricate evidence, to falsify evidence. So if I want to prove that you beat me up and I'm making a false allegation, then I will prepare an artificial bruise. What we do in this is, we take an irritant plant like Calotropis, or you can make use of marking nut. More commonly what is used is marking nut, that is Semicarpus. You take an irritant plant like Semicarpus or Calotropis. You take this plant, you take the extract of this plant and you rub this extract over the exposed parts of the body. Wherever you rub this extract over there, you will be getting a irritant response, that is artificial bruise. It would appear like a bruise, but it is artificial. It is not being caused by trauma. It is just an irritant response, because of which what you get is, you get a vesicle, a swelling, that is edema. Because it is irritant response, you get itching. It is an irritant that you are rubbing over the skin. It will cause irritation, it will cause vesicle formation, it will cause a little bit of edema. Along with that, there is itching. A true bruise never itches. Besides that, it is not by trauma. So the content of this bruise is not blood. The content of this fluid, if this bruise is acrid serum, that is an irritant fluid. It is not blood, it is an irritant fluid. And because the content is not blood, it will never have color change. This artificial bruise remains brown from starting till the last. There is no color change. A true bruise shows some color changes. In an artificial bruise, you are not getting any color change. Extravasation is not seen. Color changes are not seen. There is no erythema. What you get is vesicles. Next. Among the following, which has the highest affinity for hemoglobin? Carbon monoxide has the highest affinity. Following are the signs of acute cocaine poisoning except bugs. Bugs are seen in chronic cocaine poisoning. They are not seen in acute cocaine poisoning. Cocaine is a stimulant. It causes sense of well-being. There may be numbness. There may be tachycardia. Cocaine bugs are seen in chronic cocaine poisoning. Next, homicidal smothering and traumatic asphyxia is a cause of death in Burking. In Burking, you make a person lie flat on the ground, you sit on the chest, that is traumatic asphyxia, compression of the chest. You obstruct the mouth and the nostrils of the person, that is smothering. And ultimately that results in death, that is homicide. Homicidal smothering, traumatic asphyxia, that is Burking. Barnstola is using barns or bamboo sticks. Mugging is by elbow, that is mugging, and garroting is Judicial strangulation is garroting. Next, a patient dies of MI. What would you use to see that infarct? Triphenyl tetrazolium chloride, TTC. A 10-year-old child has consumed lots of iron tablets causing some features. Treatment of choice? Desferoxamine. Chelating agent of choice for arsenic for iron is desferoxamine. Next, a public witness was ordered to come to the court, give evidence. What is correct about this? Oral evidence. You have been asked to come to the court to give oral evidence. I'm not sure about the question that was asked. If this was the question, you can mark oral evidence. You can also mark subpoena, because your examiner is saying was ordered by the court, right? So it can be both. A better answer would be oral evidence, not an option. Mark your answer as subpoena. Just before death, a person made efforts to save himself, which led to contraction of one group of muscles. Primary relaxation was absent. This is cadaveric spasm, or cataleptic rigidity happens immediately at the time of death. Study of death in all aspects is thanatology. Disinterment of a body is known as? What do you mean by disinterment? Exhumation. Disinterment means taking out a body from grave. Disinterment. Next, which of the following is not a test of blood stain? Barbarios. Nothing is an offense done by the person because of something. What is this? This is McNaughton's rule. Although I have told you that they will be asking you only McNaughton's and the remaining you just need to remember the name, still, just remember D for Durham, D for defect. If your question, the statement of your question says that there is some defect, then the answer should be Durham's law. No need to remember the whole statement, just remember in Durham's law you would be having this word defect, only defect. If along with defect you have the word capacity, then that becomes Curran's rule. C for Curran, C for capacity. Only defect, Durham's. Defect plus capacity, it becomes Curran's. And if along with this capacity, defect plus capacity plus appreciate has been given, then that becomes American Law Institute test. A for American, A for appreciate. Only defect, Durham's. Defect plus capacity, Curran's. Plus appreciate, it becomes American Law Institute test. Next, check at postmortem hypostasis seen in carbon monoxide, hydrogen sulfide. What color do you get? Bluish green. Yellow phosphorus? Brown. And hydrogen cyanide? Brick red. Police recovers beheaded skull. Relatives of missing person give the photograph. These two can be analyzed using superimposition. What is better for identification, a DNA print or a normal routine fingerprint? Normal fingerprint, because I told you it is different even in identical twins. Cheloscopy is study of lip prints. Inquest in case of death in police custody is done by executive magistrate. Ideally it should be done by a judicial magistrate, That is not an option. Therefore, the best answer becomes executive magistrate. Anything else? Any doubts? Thank you so much and all the best for your exams. And thank you so much. And please do follow whatever guidelines I told you for your exam day. They are important to avoid any hassle at the time of your exam. Right? Thank you so much. All the best.